Hello, dear colleagues. How are you? My name is Mynzhylky Berdikhojayev, and we are from Kazakhstan, Almaty city. This is a presidential hospital, national hospital. And together with my colleague Rowan Maratlu, we are neurosurgeons. We have this patient with the dural AV fistula. He was already treated. You can see the cigar stand on the right side. Later I will explain you. Now we need to closely check the left IC territory. That's why Roland is thinking what could be the next. Okay. Usually, if you have problem in catheterization of the left ICA, it's better to take a diagnostic wire in the right brachiocephalic territory. Then we can do roadmap. Stop. Sure, please. Yes, now we have roadmap, and aortic arch is not. It looks not so problematic. Now we are in the left carotid territory. Yes, and now we can go directly. That's okay. This cigar stent was placed. Yes, 3 months after carotid stenting. The treatment done in March, and at the same time we went from the meningeal artery, and it was supplied from the ophthalmic artery also, but today the small part of dural fistula is remaining. That's why we took this patient for the treatment. Yes, and patient has a quite nice anterior communicating artery. Okay, let's discuss. I'm thinking about attacking from the left to right. You can see there is a meningeal branch going like this, and I think it's only branch going to this fistula. This is a vein. If you can see, this is artery and this is vein, and it's draining to the cavernous sinus and the sphenoparietal veins. The flow is not so high, that's why it's a good picom on the left. And now I see patient has a good ACOM, and it's possible to go from left to right and catheterize this artery quite easily from the left side. Or we can place the balloon and we can do balloon assist catheterization. Which option will be better? Okay, let's go from the right side. We need to complete the diagnostic angiography on the right side. It's a vertebral artery. It's a carotid system. Okay, let's check first the... Okay, first I think we need to check the ECA territory. Трудно. Yes, and patient under local anesthesia. The feeders is quite small and it could be painful, the catheterization and the liquid embolic injection. That's why we decided to take this patient under general anesthesia. Yes, as you know, in our practice we can go with the local and general, but this time we decided to go with general anesthesia. Okay. Now we are in maxillary artery. Okay. We need to focus on this territory. As the last time, the feeder was from the meningeal and we came from meningeal. It looks like there is something from meningeal, huh? Ah, there is a small feeder from meningeal. I think we can complete from meningeal. Okay, назад. If we can go to this small feeder, then we may finish this dural fistula. Вперед. Okay, let's start from here. The only thing we need to go with the Sonic 1.2. Sonic Berdikhojayev ашып бере салшы, шкафтың ішінде бар. Несімен бірге? Сквит жинай салшы. Дымы сөз жинай салшы, сквит емес. Ау, Berdikhojayev несімен? Ана, надписи жоғын. Надписи жоғын. Аха. Мына 35 қасында жазу бар ғой, оның ішінде гибриді жоқ. Мынаның ішінде гибриді бар. Yes, in this 1.2 there is a hybrid in the package, and the second one with the additional abbreviation, and there is no hybrid inside. Okay. Maybe we'll place headweight duo also, but we'll see. That's why it's very important to check all territories. And about the patient with callosal AVM, patient had a nice breakfast. That's why we discussed with the wife of the patient and we left him for the evening. He will be patient number 5 for today. And the next case, we have one MCA aneurysm and one suspect for dural fistulae in cavernous sinus. He will be for diagnostic angiography. Yes, we have one MCA small aneurysm on the left side, and then one more patient with dural fistulae, and at the end of the day we will have the patient with the callosal AVM. Он пока жинамай тұрмын ба? Пока қоя салса. Yes, and time to time we are speaking in Kazakh language with the Rawan. It's my native language. And I like to speak in Kazakh. Sometimes we are mixing with the Russian language, which is also the second language in the country. It's not my native language, but it's a second language in the country. From the Soviet period. It's good. You can speak also English. Экранды 10 сантиметр өзіңізге аяққа қарай тартасаңызшы. Okay, the guiding catheter is 8 French. In the case of complex balloon assist catheterization, I prefer to use 8 French, and I think the practice I started after. Yes, I exactly started after visiting the Essen in 2012. I completely changed all my access devices, and since 2014 we start to use more actively coronary guiding catheters, and thanks to the distributor company, they gave to my colleague the samples of Judkins Wright coronary guiding catheter, which was Zenitix 7F guiding with the side hole, and nobody wanted to use it, and I asked him to give me the guiding catheter, and I brought it to Almaty, and it was the beginning of using the guiding catheters, coronary one, in our practice. Yes, the branch is coming somewhere here, not here. I think we need a headway duo. No. Now wire is going to the branch, and I hope the Sonic can follow it. Yes. The branch might be too small. Okay, I think we need to place a headway duo and a couple of coils after and a couple of coils before, and then we can inject through this Sonic. Okay? Headway duo и Traxxas. Yes. I need to look for the place with the more quotation, or maybe in September, if we will finish all budget in the country, then I will start to think about to work part-time in foreign country, because I don't want to send my patient for the private treatment. It's quite expensive in the country, and the material in the country is really costly. And okay, there is a lot of ethic points. We have an insurance system, and it's really nicely covered cardiac surgery, coronary interventions, but for some reason the guys in the healthcare administration decided to cut the budget of the neuro procedures. I don't know who initiated this and why it's happened, because in coronary the TAVI intervention is quite popular, and there is no limit. There is no real limit in TAVI intervention, in coronary intervention. Yes, maybe the patients are mostly dying from the coronary pathology, but the stroke is not as less making injury. Yeah? Stroke is making injury for the patients, and okay, there is a lot of questions. Yes, but finally nobody is caring about the patients. It's just about the okay, let's base do distally. No, shit не sauces. There is another branches. Quite interesting. Назад. The dural supply to the ophthalmic artery was occluded last time, and we did a good disconnection between ophthalmic artery and okay, I will try to push sonic a little bit more. Okay, it's stuck at the hole. Так, малым ақ шприц ашып берсеңші. Столдың үстіндегі бір ақ шприц бере сал. Yes, that's why it's important to occlude the venous part, and last time we couldn't reach the venous part. Yes, it's too small for this sonic. Вперед. Вот. Назад. Вперед. Вперед. Назад. Вперед. Okay, now we have a roadmap. I will try to go distally if it's possible. Okay, let's go destroy it as much as possible. I will take this one. Yes, it's better to exclude this dural fistula from the external circulation than the intervention, smart mask. Then the intervention from the internal carotid could be complicated. Okay. I need to bring my headway a little bit back to proceed with the sonic. It's too soft wire. It's unstable on the proximal part, that's why it's going all the time to the it's bulging. It's bulging. I couldn't push. I couldn't push it. It's here all the time. As it starts bulging. Okay. Okay, let's look from this point. It's a limitation of the soft wires. It can go from the Стоп, вперед, вперед. Още трудно. Смарт маска. I need to check where is the tip of headway door a little bit down. Okay, let's bring the headway door a little bit up, and then we can isolate this branch with. Okay, I understand how to do it. We need the traxes. Traxes. Okay. Take this. For this dural fistula, the alternative option could be microsurgery, yeah? Rowan. The microsurgery could be the... Oh, now it goes on to this branch. It's so-called... I need to occlude the lateral branch with the coil placement. And it's go only this branch. Okay. Okay. Let's go to this point. Okay. Okay. There is also one branch going to the fistula territory. Назад. Okay. Okay, let's take coil 1.5 by Berger'n X переговоришь? Berger'n 1.5 by 4 for this point, and then let's place downstairs and Berger'n microplex. Microplex. Berger'n мека. Хорошо. Berger'n 4 солнце. Optima Berger'n. Iki ona şey sразу. Я отделялся на этой солнце. Поэтому ты пришехал же солнце. А что он? Келес пациента келес. Okay, let's isolate this segment with the coils up and down, and then we may concentrate mostly on the pathology. It goes like a wire, huh? Okay, let's leave it here. Отделить. Ветер. Так, I think now good. We can place one more. İki de 6 bir spiral verirseniz optimum. Tez geldi. Yes, it could be the discussion of the microsurgery, but patient under on dual antiplatelets, and he's 63 years old with comorbidities, and I'm not sure this is so pretty to treat the guys in his age with the microsurgery. Делать. Белеврис. It's arterial supply downstairs. Okay, we'll use this headway duo later on. That's okay. Okay, I will take this out. Maybe we can use it later if it's needed through the internal carotid territory, eh? But I hope it will not. Okay. You see the venous part, and we can focus mostly there. And focus here. So that's good. That's good. Наркоз поглубже, дексаметазону некое. Наркоз стирингрик. deeper narcosis, and dexamethasone 12 milligram. It's quite painful procedure, and only point we have this branch supply, but this is also occluded and isolated. We can use it. And this is a vein. This is a vein. And this is a vein too. Пациент қымырлап жатыр, қимылдап жатыр. Қымырлама деп айтыңыз. Patient is moving. It's a good sign. The level of anesthesia is checked. Okay, I think it's the same problem in many places. In many places the same. That's why we're asking for make the anesthesia deeper. To make the anesthesia deeper. Промывка жемстептума. Новая, да, промывка? Я вот схожу мысль. Ұйықтады ма? Жұмыс істей берсек болады ма? Yes, the system of the preparation of anesthesiologists needs the improvement. The whole healthcare system needs improvement, not only the anesthesiology. Okay. Okay, we have this. We need to fill this venous part to exclude the fistula from the circulation. Till here, from here. Okay. Glue? Glue? Радиация екі қойсың. Okay, thank you. It's quite comfortable to work under general anesthesia when you inject liquid embolic. Yes, then we'll start to fill the venous part. I will continue. The dural branch is it's a cavernous part, and it could be the branch from the ICA. Yeah? We need to keep in mind the territory from the ICA. Yes. Следующий. Следующий. Дальше. Ага. Вперед. Стоп. Вперед. Вперед. It's now try to reach the ICA territory. I think it's an arterial connection. To control this territory, we need to bring the guiding down. Okay. Now we can clearly control the internal carotid territory. I think there is no more fistula. Yes, it looks like there is no more fistula, but we will continue. Now we have markers the IC we can... Так, плюс-минус хочешь? Okay. We don't need to go down till this cast of the liquid embolic. And now the liquid embolic will go from the second branch. It's refluxing, it's okay. But it's not going to the smaller branches. Huh? Okay. Okay, let's wait a little bit. We have time. Yes, we isolated arterial part, but I'm not sure how much we occluded the vein, but the beginning of the vein is already occluded with the connecting arteries. Good. Yes, I'm looking for the meningeal, but meningeal is not more... Period. Meningeal is not more connected to the period. Yes, it's disconnected. Period, назад. Period. Stop. Period. Stop. Minus. Yes, it looks like we disconnected it. Так, назад. Ровно. Yes, it's very important to disconnect the external carotid with the internal carotid to cure the pathology. Okay. Now it's a prophylaxis of subdural hematoma. Okay, we can go out. Кресло. Yes, it's clear. Okay, let's analyze. Good. Good. Yes, there is no vein anymore, and I think we can finish the case. I will ask Rowan to do expert CT, and then we can finish. Okay. Let's wait for the control CT. Dear colleagues, the interventional tool it's working. Yes, subdural space is clear, the brain part is clear. Now we can finish the case and see you in next 30 minutes. Next case is dural AV fistula, MC aneurysm, one of them. We'll see. Thank you.